Well, India reported 16,678 new coronavirus cases in the last 24 hours, and the recovery rate stands at 97.99%. As COVID 19 continues to surge in the country, COVID related queries are on the go. People are speculating about health problems, and we get you queries on kidney health and on renal transplants queries today. In this program, we take your questions live also from Facebook and YouTube. And today we're joined by the very well known doctor, Dr. V. Seenu, Professor Surgery at the All India Institute of Medical Sciences. Namaste and welcome to India Science, sir. Thank you so much for joining us. Such a pleasure. And I love the backdrop. To begin with, yes. To begin with, please tell our viewers about the current, scenario in India as far as Omicron, COVID-19, new strains. How do you prioritize urological management, kidney management in such times? Is there any specific protocol that we're following at AIIMS, sir?
Yeah. First of all, thank you very much for inviting me to this program. Basically, we can take a lot of positives from the currently existing situation as far as COVID-19 is concerned. Positives in the sense that there is no documented wave as it was looked at with apprehension. That's number one. Second is whatever infections are happening, they seem to affect only the upper respiratory tract. That means your nose and throat and not going into the lungs. So that's making life easier because patients are not becoming breathless, short of oxygen, or needing oxygen support or ventilatory support. And third thing is the symptoms are also not as severe as it used to be in the earlier waves of COVID-19. And the symptoms are mostly mild, and the majority of the people are recovering at home only. So these are the positives as far as the current situation of COVID-19, the Omicron and its sub-unit infections are concerned. Now coming to the kidney transplant or kidney related services which are provided at All India Institute. Again, like as compared to the first and second wave, there is not much effect going on, but still some patients who are presenting with fever, who need surgery, say like yesterday, like right today morning, one patient needed liver transplant, and we tested the patient, he has come COVID positive. So patients who are undergoing transplant surgery or any major surgery here, they are being subjected to COVID test. But the positivity rate is much, much lower as compared to what it was before. So the urological diseases, they're more or less the spectrum, since the COVID-19 is less, more and more patients are coming to tertiary care centers. So the numbers are back to what it was in the pre-COVID era, but the services are also almost similar.
Sir, thank you so much for that insight. And now I'd like to ask you on your specialization, which is good kidney health. So, how do you define good kidney health and prostate health, sir?
Yeah, see, basically, when we say good kidney health, is that patient has no symptoms related to either formation of urine or the quantity of the urine which patient passes every day, or the quality of the urine. Okay. So the formation of urine, basically the urine forms by small cells called glomeruli in the kidney. So that is one thing. And these can get affected by common causes. As I said, the commonest cause of kidney failure or end-stage renal disease, which needs some sort of renal replacement therapy, is diabetes and hypertension. So one is that whoever is a diabetic, he should take medicines regularly, do the diet modifications as advised by the doctor, follow lifestyle measures, good exercise, avoid smoking, alcohol. So these are the things. And then when I said quantity of the urine, again, as I said, the urine is produced by the kidney. So one is the quantity can become less because of the kidney is affected, or Sometimes what happens is, if the outflow tract, again, if the, say the prostate is enlarged in elderly males, then though the amount of urine formed is good, but patient passes less quantity of urine. So that is another area. Like again, prostate, see, for most of the diseases which affect human body, especially cancers, the places where the cause is not known, most of them have some relation to smoking, alcohol, obesity, fatty diet, and lifestyle measures. So these should be taken care of. And other thing I told about is again the quality of urine. Like if somebody has stones, he may pass pustules in urine or blood in urine, and also this. So anybody who doesn't have any of this, like who has good amount of urine formation, quality is good, and passes urine normally, so that is good kidney health actually in general.
All right, doctor. Can you tell us now what are the warning signs of a kidney infection for all our viewers to understand this more
Yeah.
correctly?
So to know what are the kinds of the kidney infections which we call as urinary tract infections. The urinary tract is kidney, and then there is a tube which brings the urine into the urinary bladder, and then you pass out. So this is called as urinary tract infections. There are two types broadly. One is a acute infection. Acute infection is something which has come very recently, say 2 days, 3 days, 1 week, or 2 weeks. Whereas a chronic infection is patient has it for say many years or many months. Now, the commonest cause of acute urinary tract infection depends on the age and the sex of an individual. And we know that women have much higher incidence of urinary tract infections as compared to males, because in women, the urethra, the tube which passes urine from the bladder is short, and it is very close to the opening of uh, the birth sac, which is the uterus, the vagina, and the urethral orifice. They are very close, so the infection rate is much higher in them. So what we recommend in them is a good personal hygiene, which reduces the incidence. But in a woman, we consider any infections less about up to three in a year as normal. Whereas in male, if has more than one attack of urinary tract infection, then we need to investigate. Because in males, if there is urinary tract infection at a very young age, then you have to look for some congenital abnormalities. Whereas elderly people, it is usually because of, as I said before, the prostate enlargement. As once you grow older, the prostate tends to get enlarged, and that causes obstruction to the urine stays. And once urine stays, since it has organisms, they can grow. So these are the two types of urinary tract infections.
Right, doctor. My next question to you is, can kidney infections be cured? And how serious can kidney infection be?
No, all kidney infections can be cured. See, first is we have to find out a cause. Suppose there is a stone, and if you treat the infection, it won't become all right. So you have to take care of the stone. Suppose somebody has a prostate enlargement, you have to take care of it. So these are the important things. And all urinary tract infections can be treated. There is something called as chronic urinary tract infections, which are usually something like tuberculosis and all. Like in this day and age, more than 90% of the chronic UTIs can also be treated.
Right, doctor. It can be a recurring one because it is now being seen in many young girls also.
Yes.
You hear this term UTI infection very often. So why is that so? And what
Yeah. Do you
precautions
know
can these
somebody has
young ladies take?
more than twice or thrice infections in a year? We call it as recurrent urinary tract infection. There you have to go after the cause as to why it is happening and then treat it accordingly.
Right, doctor. My next question is, minor infections such as UTIs, colds, flus are common after kidney transplants. Potentially more serious infections such as pneumonia and cytomegalovirus (CMV) can occur and may require hospital treatment. So, what exactly is CMV and such infections, serious infections? Um, is this true, firstly?
Yeah, I think a very, very good question. See, whenever you do a kidney transplant, the kidney comes from another person. So your body recognizes it as a foreign body, and then tries to attack and destroy it. So that's what our body's immune mechanism does. So when somebody undergoes kidney transplant, you have to give medicines which can decrease your immunity. And since your immunity is less, you're more prone for infections. But the good thing is the body tends to get used to it. So most of these infections occur in the first 3 months, though they can occur later also. Most of them, if they can be life threatening, they occur in the first 3 months. And the infection can be, as you have stated, it could be bacterial infection, it could be a viral infection, like as you said, a CMV or AB virus infection. Or so these infections are treatable, but you have to pick them up very quickly, because if you don't then pick them up quickly, the patient deteriorates fast. So that's why when a patient has any symptoms relating to urinary tract, such as burning or frequency, undergone transplant, we immediately do urine routine analysis, urine culture, and start the antibiotic straight away. And after the culture comes, based on the culture, we change the antibiotic. So if you pick it up early, you can treat it quickly, and you can have successful outcomes.
Right, doctor. To a layman, how would you explain a kidney transplant?
Yeah, I think again
And
very
what are
see,
the
see
yes.
basically when does a person need kidney transplant? He needs kidney transplant when his both kidneys fail. Normally everybody has two kidneys. Rarely some people may have one, but so it is that more than 90% of your both kidneys are destroyed, then only a person needs kidney transplant. And why do they need kidney transplant? Three important reasons. One is your blood forms in the body. One of the important factors which affects blood formation is a factor which comes from erythropoietin, which comes from the kidney. And second is your bone strength also depends, because the vitamin D, it is metabolized in the kidney. And third is the waste products of the body, they are excreted by the kidney in the form of the urine. So whenever there is a failure of kidney, all the three will be affected. So when a kidney is affected, you don't form urine. The as I said, waste products accumulate. So you can take them out. So this is called as a renal replacement therapy. You are replacing the kidneys. Renal replacement therapy can be hemodialysis, peritoneal dialysis, or a kidney transplant. Now, as I said, hemodialysis and peritoneal dialysis, if you do, then your blood formation will not happen, so you have to give extra medicines. Your bones will be weak, so you may have to give. Whereas if you do kidney transplant, all the three are taken care of. Now, where does the kidney come from? The kidney has to, as it stands today, it has to come from another human being. So you get two types of kidneys. One is that if somebody has an accident or some brain hemorrhage and he is brain dead, you brain dead means he will not wake up. Okay, so brain dead. So from them we take the organs, and this is called as a deceased donor transplant. The other is a live transplant. Transplant. There are some laws in India which are passed by Parliament. Currently, only a relative can give a kidney. Who is the relative? Relative could be a father, mother, brother, sister, wife, or a spouse or grandparents. So these are the people who can give the kidney for a live related transplant. So you take the kidney from another person, you're giving it. So for the kidney to survive, you have to give immunosuppression to the patient. So this is in short about kidney transplant.
Absolutely, doctor. Now, I want to ask you another question, alluding to what you said earlier about a live donor, a relative or somebody in the family. Uh, is it a very expensive process, or is it a very long wait for people who cannot get a kidney from their own relatives? Sometimes the relatives are not keen. In such circumstances, what should the patient do?
Okay. See, basically, the process starts with is one is you have once somebody has kidney failure, and you know that it is a chronic end stage renal disease, which is called as, then we start looking for the donors. In the meantime, patient undergoes hemodialysis or peritoneal dialysis. Now, how do you go about is you first check the first degree relatives, as I said, and you check the blood group, the possible, then you check whether both the kidneys are functioning in person, whether he has diabetes. And once all these are checked and you find somebody is suitable, then you see, if it, nowadays you can go across blood groups also, but matching blood group, you take the kidney and you transplant. So as you said, in some instances, you don't find the recipients. So then there is something called as a altruistic donor, like somebody who is a emotionally related donor. Suppose somebody is not there in the family who is of same blood group or of a good health who can give, then some very close friend or very close relative But then the criteria are very strict. The consent is all done under a video recording, and you need a authorization committee to approve and all. So if none of these are suitable, then the patient goes into the list of the deceased donor. As I said, a brain dead patient from whom we take a kidney. So that is called as a deceased donor program. So patient goes into that. And as far as the waiting list is concerned, the waiting list, as you can see here, the number of organs currently available in India, and number of people who are having kidney failure. Suppose 10 are having kidney failure, only one is getting a kidney transplant. So this much is the difference. And the number of centers are also not many, especially in the government sector. Now, coming to the expenses in the government sector, like All India Institute, it doesn't cost much to the patient, and we have like this Pradhan Mantri Yojana and all, where they get support from the Prime Minister's fund and all. So, and those who can afford, they go to private. In government sector, it costs somewhere around 70 to 75,000. In private sector, it ranges anywhere from 2 lakhs uh, onwards. So, what for the money is used is for the investigations and for the first 3 months of immunosuppression drugs. So this is the amount which will be needed for the patient.
Absolutely, doctor. Now, I'd like to ask you, there is something known as a preemptive or a early transplant. Mr. Rajesh Lakheria writes to us from Meerut to know what is a preemptive or early transplant. If you could please
Yeah,
explain that.
yeah. It is little more scientific question, but a good question again. See, as I said, when somebody has kidney failure, so we put them on dialysis, and like in US and all, since the organs are not organs shortage is there all over the world. So in the US, majority of the people who are above 70 years, they're on something called as the maintenance hemodialysis. That is, they get a dialysis done every 3 weeks. They go to the hospital, sit in a chair, they undergo dialysis, they come back home. So you can continue like this for, say, even in India, in a young patient for 2 years, 5 years, and all, and then meanwhile you arrange the kidney. So that is called as a elective kidney transplant. Preemptive is, we know that the kidneys have failed. We know patient is having end-stage renal disease. He may need a renal replacement therapy. So before the patient develops any complications or goes on dialysis, you do a transplant. That is called as a preemptive transplant. You are preempting the complications of end-stage renal disease.
Right, doctor. Another question has come to us from our YouTube, and this comes from Shubham just now, and she wants to know. She stays in Noida. What if her body tries to reject the new kidneys, and what kind of complications can happen with a kidney transplant?
Yeah, what if the body tries to reject the kidney? That is the first thing. So if body rejects the kidney will fail again. So patient has to go on dialysis once more and again look for it. So why it happens is, as I said, body has a defense mechanism. Like every day we get cough, cold, we get injured, it all heals. That is because of the body's defense mechanism. So whenever you put a foreign body, the body tends to attack that. So to avoid that, we give something, as I have told you, immunosuppression. There are medicines which are given to suppress the body's immunity, so that the kidney is protected. After some time, the body starts realizing it as part of the body, and then maybe later in life you may be able to reduce the medicines to a certain extent. So that is how the immunosuppression works.
Mr. Bhaumik writes to us from Northeast, sir, and he wants to know why the old kidneys are not removed. What happens to the old kidneys, doctor?
Uh,
Mr.
the old
Somnath.
kidneys are not removed normally, but there is something. See, basically, the kidney is put in the abdomen in the lower side. Suppose your kidney has failed because of something called as a bilateral polycystic kidney, where the kidneys become huge and occupy the whole abdomen. Only in such circumstances we may remove the kidney. The second instance is if patient is having blood pressure which is not getting controlled in spite of medicines, and we find something called as there is a stenosis in the renal artery, then we may do it. Otherwise, yes, kidneys are not removed, because removing kidney is another major operation. And these kidneys have already, they are not making any urine. There is no infection in them. So there is no disease which can get aggravated in that kidney, because the disease which happening, it is going to destroy the kidney and stay there. So that's why we do not remove, because that adds more burden to the patient, because removing the kidney is a major operation. So a patient is already in end stage renal disease on dialysis, subjecting him to death those surgeries, that is not needed. That's why it is not done.
So, are you saying, doctor, that the old kidney can remain in the body of the patient even
They
after a
always,
transplant?
yeah, they always remain there unless some very specific indications.
Right, right.
And
Right, doctor.
yeah,
Does kidney transplantation affect sleep and fatigue, um,
the other way
after
around. The
post-operative?
other way around. When you have end stage renal disease or chronic kidney disease, your sleep gets affected. You are fatigued basically. And the fatigue and sleeplessness will become much better after kidney transplant. In fact, they become much better. Patient almost does normal back to normal activity.
Right, doctor. And is it better to get a kidney from a living donor rather than somebody who's been brain dead or something like that? And are there any disadvantages to living donation? Is another question that comes to us from Hyderabad. Mr. Munish is asking this question.
Yeah, see, given the best choice, your own kidney is the best. The second best kidney is, suppose there are twins and if they are monozygote, that is they have come from the same egg. That is the second best. Okay, because in this you may not need immunosuppression at all. Now coming to live related and deceased donor, currently with the type of immunosuppression which is available, the results are more or less the same. But if somebody has a choice, somebody is giving the kidney, then yes, live related donor is definitely better than deceased donor transplant.
Yes, doctor. About hypertension and diabetes and such like disorders, do they worsen kidney failure?
Yes, I told you, like they are the most important causes of end stage renal disease. World over, if you see, the commonest cause of end stage renal disease is diabetes. The second commonest cause is hypertension. In India, it is slightly reversed. Like again, it's now more or less the same as in the West. It is used to be hypertension followed by diabetes, but now I think it is the same as elsewhere. In fact, not only they affect the kidneys, they damage the kidneys completely, both diabetes and hypertension.
Right, doctor. Another question that has come to us is that if the kidney problem is chronic, you mentioned dialysis earlier. How long can the patient continue without dialysis, and how frequently is another question? Does the patient need dialysis? Is it on a daily basis? Is it once in 2 days, depending on the condition of the kidney? What are the insights on this?
Yeah. See, basically, when do you start a dialysis? As I said, you start a there is something called as the end stage renal disease, which is chronic kidney disease is graded from grade 1 to 5. When somebody has a CKD 5, which is called as end stage, then only we start thinking about a patient undergoing renal replacement therapy. So the initial most places the common renal replacement therapy which starts is hemodialysis. That means that you take out the blood of the person through one vessel and it goes into a machine, comes back through another blood vessel into the body. So thereby, while it goes through the membrane, all the toxic products are removed. Now, how often it needs is most patients will need it about twice a week. Some patients in the later stage will need it thrice a week. And as far as somebody surviving on kidney on hemodialysis, as I said in the West, hemodialysis is the commonest renal replacement therapy because there the older population is much higher, and after 70, usually you do not recommend a kidney transplant in majority of the cases. So they do survive for 10 years, 15 years on hemodialysis.
Right, doctor. Another question that comes to us now is from uh, Mr. Ravinder from Delhi, and he wants to know the cause of renal transplant failure. Sir,
Okay.
and what
This
is renal transplant? If you could please explain that,
renal
doctor.
transplant is, as I said, that somebody's kidneys fails. I take kidney from another human being and put it in the patient. That is called as renal transplantation. Now, can renal transplant fail? Yes, the renal transplant can fail. As I said, because your body, in spite of giving the medicines which suppress your immunity, the body may reject it, which is called as acute rejection. So again, if there is acute rejection, what you do is you increase the dose of the immunosuppression. You give them little more steroids and all, and about 90% of those which are acutely rejected, you can salvage them. And the other reason why it can be is over a period of time, say after 10-15 years, there can be chronic rejection. And once chronic rejection occurs, then not much can be done. Then patient will need a second transplant. And the third reason is whatever disease which has happened, if you have not controlled it, say diabetes or hypertension, they can affect even the kidney which is transplanted. There may be some diseases which can come back even in the new kidney. So these are all the major reasons why a kidney transplant can be a failure.
Right, doctor. The next important question is that management of kidney stones. Why do we find people, um, um, having kidney stones, and how could we perhaps prevent these stones? I'd like to know.
Yeah. See, basically, kidney stones, uh, there are something called as kidney stones which form in we can't ascribe one particular reason. And there'll be patients with kidney stones, we know that this is the cause of the stone formation. So whenever a patient with kidney stone presents, first we try to find out whether there's any cause for which the patient has formed a kidney. This could be something like if your calcium is more in the body because of some gland called as parathyroid in the neck. So if hyperparathyroidism is there, patient has more calcium in the blood, so they tend to pass more calcium in the urine and they form stones. So in those conditions, if you treat the hyperparathyroidism, the stones will not form. Similarly, if there is some congenital abnormality in the kidney which is predisposing to the formation of stone, then you try to rectify it and so that the stones don't form. But in majority of the patients, the stone formation, we do not know why it is exactly happening. So once we rule out that there are no particular cause, then treatment of stones is basically, if a patient is symptomatic of stones, then you have to treat the symptoms first, then treat the stones. And in the current day and age, majority of the stones can be managed without a major surgery. That is the important thing. And what precautions do you take? Since we do not know the cause, they can form stones again. So what we tell them is we ensure them that they should take plenty of fluids. Then they should not take medicines which can predispose to formation of stones. Suppose somebody is forming uric acid stones, then they should not take things which can increase uric acid in the body. So these are all the precautions. But the most important precaution is to drink plenty of water. That is the most important thing, and avoid having infections. If there's an infection, you should get it treated early.
Doctor, another thing I'd like to know is the status of genetically engineered artificial kidneys, especially in renal transplant.
Yeah, this is the future hope actually. So there is people are trying that there's something called as stem cells. They take your stem cells from the body and they try to. Stem cells are cells which have the potential to convert into any organ in the body. So there are efforts now which are being made that you can grow the kidney by taking the stem cell and all. It is still in a very nascent stage, but yes, that will be the answer for most of the problems regarding the shortage of the organs currently.
Any other advances as far as gene therapy is concerned in this global era? Would you like to touch upon something?
Yeah, like probably for some diseases which predispose to kidney failure, like some genetic deficiency, enzyme deficiency. So maybe those sort of things, but nothing in the near future. But yes, definitely that is the future.
Right, doctor. I think we're running out of time. And in the end, I'd like to thank you, Dr. V. Seenu, for joining us and sparing your valuable time in educating us. And with this, friends, this is a wrap on this edition of Let's Talk Health. We'll be back with more interesting episodes. Until then, stay vaccinated if you're not already. That's the only way. Stay safe. Keep that mask up. On that note, Namaskar. Thank you for watching India
Thank
Science.
you.
Namaste.
Thank you.